Hi, so my name's Prashant. This is Kevin. He's been a patient of mine for about 2 years now, and when he first came in, he had a few missing teeth. He had some problems in the front, and from a technical perspective, his bite essentially was shot. The dynamics was going to lead to more loss of teeth. The fracture of the front tooth is quite symptomatic of when the bite shot, and then everything's going to accelerate and break down quite quickly. So he was quite typical of some of my patients, or a lot of my patients that come in with similar problems. I generally specialize in that sort of building bite rehabilitation work, and to me the solution was quite straightforward. But we did talk about 3 options. We did talk about alternatives that would, may suit him. Luckily, he was, quite receptive of the information we provided, and chose, in my opinion, the right option. Sure enough, it took a long time, but if it was my mouth or my parents' mouth, that's exactly what I would do. I wouldn't talk about it, I'd just do it, but that's what happened with him. We had to build up the lost bone, so there was a bit of wait time due to the grafting procedure, and waiting for that to consolidate. And thankfully, he's been quite a patient. A lot of patients would find it difficult to have missing teeth for such a long time. We do have other solutions for them, where it's more like a teeth in a day solution, but he was thankfully different, and he accepted the most appropriate solution I had to offer. We waited, got the grafting done, and then we did what's necessary with the implant placement, used CAD/CAM generated guides to precisely put the implants in. That's all part of the planning process. Careful planning, that's the key to the success. And he was then very accepting of changes that would have improved the solution. And you only find out about those changes as you go through the journey. So, we've had some in-depth discussions and, collaboration in getting the right outcome. And that's basically what I would say it is. It has been a collaboration to get to the end where I'm very comfortable and very confident that this is the best outcome I can provide him. And it will hopefully last him a long, long time without causing any problems.
And the technicians can come down and look at my teeth while I'm here.
Yeah.
It's a big advantage.
Big difference, yeah. And correct every micrometer of issue that I demand, which is
high.
It's all part of it. Yeah.
I've had sort of problems with my teeth for some years. They were compromised through lack of care, and also I think probably there's some genes in there as well. I went to my dentist. I had a tooth collapse, and then it was decided that it should be extracted. He referred me to Yesva Singh down in Campbelltown, and I was very happy with Yesva. I went into, I got the extraction, I think, in his rooms, and then it was pretty obvious that my mouth was severely compromised. So the option came up, do I get a denture or implants? They seemed to be the 2 options. I wasn't keen on having a denture for a number of reasons. So then it became, the choice became an implant, and then Yesva took me over who could do that sort of work. Previously, I'd come across a periodontist that offered that service, but I understand his expertise is in gums. So I wanted someone that was an expert in this, because we only have one mouth.
That's right.
So I wanted the best possible outcome. So I came, he recommended a prosthodontist and recommended coming here. I came here, and then you did an initial evaluation and then came back with a treatment plan, and with several options in that. I should say that I wasn't convinced about the 4-on-1 treatment or having an implant and walking out with new teeth in a few days. That didn't make sense. So I started the journey. The journey involved having bone grafts, because I had the jawbone in my mouth was depleted, and that then there was a waiting period of 6 or 7 months. The longer the better. I wanted to be as conservative as possible. I wanted the best outcome possible. And then I came back here. I also was having nasal surgery sort of at the same time. I wanted to be the new man. And then I think I entered Campbelltown Hospital. I chose the treatment plan that I wanted. Into Campbelltown Hospital, had I think 8 titanium implants, and then was walking around with missing teeth for a time, but I had quite a long moustache at that time, so it wasn't such a big problem. And then Prashant, you put some temporaries in, which were almost as good as good teeth. You know? And then over a period of months and coming up here and staying at the Meriton Apartments across the road, I ended up with a full set of exquisite implants and abutments. So I was very, very happy. I like the meticulous nature of what you did. I was utterly confident in your expertise. So that's the long answer to the short question. That really required a yes or no, did it? Or?
Oh, no, that was brilliant.
Yeah.
That was brilliant. What I'm intrigued about, and having known you for all this time now, and I know how meticulously detailed you are in selecting the surgeons that have done very delicate surgery on you, even recently. How did you decide on committing to such a big process? Because I'm sure you understand this was quite a big project, much more bigger than some of the surgeries you've been through. Nasal surgery can happen in a day and it's done.
Yes.
It's a big project. What made you decide to say, okay, I'm going to go with this, guys?
You're a specialist. That was the thing. So your expertise is in this. It's functional and aesthetic. So I'm interested in the function of my teeth. That's their primary purpose. I wanted to have the best outcome possible. And the research that I did, and it's when you're researching a specialist, what's available to you is only a little bit, but I was pretty happy with what I came across. It wasn't a dollar-driven decision. It was a functionality and quality-driven decision. So that was why I came here. So specialist, good reputation, recommended.
Yeah. That's all you needed.
Yeah.
In terms of expectations, have we met them? Like, you came in and you had some issues, we talked about it. Understanding that at the start and having something at the end are two different things, because it's a bit of a journey. You don't know till you go through it. That's with every patient, by the way. So have we met your expectations?
Yes, undoubtedly. Of course, a patient's naive entering it, and what's everyday knowledge to you is brand new knowledge to me. Yeah. So there's a bit of a hurdle to jump there, and some of the questions asked by me were probably considered to be naive, but you imparted a fair amount of knowledge so that I had enough knowledge to make decisions, and I like that. Yeah. So
they were well explained.
Yes, no, they're very well explained. The days in the chair, I didn't mind.
Literally days in the chair.
They're literally days in the chair.
A day at a time.
A day at a time, and when you explain it to people, they're sort of, they're not horrified, but they think, God, it must be difficult. But it isn't. It isn't. It's virtually, perhaps in some ways it's uncomfortable, but you wouldn't really say the work was painful. You wouldn't put those two things together.
No.
Yeah. So I was very surprised that the injections aren't supposed to hurt. They don't. So it was great.